Hello and welcome. Today we're diving into a rare but serious congenital heart defect called total anomalous pulmonary venous return, or TAPVR. We'll explore what it is, why it happens, how it affects the body, and what can be done about it. Let's get started. So, what causes TAPVR? Essentially, it's a developmental problem that occurs very early in pregnancy, typically during the first 8 weeks. The pulmonary veins, which normally carry oxygen, rich blood from the lungs back to the heart's left atrium, don't connect where they should. Instead, they drain into another vein or directly into the right atrium. The exact reasons why this happens are still unknown, but it's believed to involve a combination of genetic and environmental factors. Researchers continue to investigate potential links, but as of now, there's no definitive answer to why TAPVR develops in some babies. Now let's understand the pathophysiology, or how TAPVR disrupts normal heart function. Normally oxygenated blood from the lungs returns to the left atrium, then flows to the left ventricle, and is pumped out to the body. In TAPVR, this oxygenated blood takes an abnormal route. Because the pulmonary veins don't connect to the left atrium, the oxygenated blood gets mixed with deoxygenated blood in the right atrium. This mixed blood then goes to the right ventricle and is pumped to the lungs. For the baby to survive, there must be an additional connection, called an atrial septal defect, or ASD, which is a hole between the left and right atria. This ASD allows some of the mixed blood to cross over to the left side of the heart and be pumped to the body. However, this means the body is receiving less oxygenated blood than it should, and the right side of the heart has to work much harder to pump blood to the lungs, leading to pulmonary hypertension and heart failure if left untreated. TAPVR is a relatively rare condition, affecting approximately 1 in 10,000 live births. It accounts for about 1–3% of all congenital heart defects. There doesn't appear to be a significant difference in prevalence between boys and girls, and it occurs across all ethnic groups. Because it's a congenital defect, it's present from birth, and early diagnosis is crucial for the best possible outcome. The signs and symptoms of TAPVR can vary depending on the type and severity of the defect, as well as whether there are any other associated heart conditions. In severe cases, infants may present shortly after birth with cyanosis, a bluish discoloration of the skin due to low oxygen levels in the blood. They may also have difficulty breathing, rapid breathing, fatigue, and poor feeding. In less severe cases, symptoms may be more subtle and develop over time, such as slow growth, frequent respiratory infections, and heart murmur. It is important to consult a doctor immediately if you notice symptoms of TAPVR. Diagnosis of TAPVR typically involves a combination of physical examination and diagnostic tests. A doctor may suspect TAPVR based on a heart murmur or cyanosis. Further testing can include an electrocardiogram (ECG) to measure the heart's electrical activity, a chest X-ray to visualize the heart and lungs, and, most importantly, an echocardiogram, which uses sound waves to create a detailed picture of the heart's structure and blood flow. In some cases, a cardiac catheterization or RI may be needed for a more precise diagnosis and to plan for surgical repair. TAPVR is classified into 4 main types, based on where the pulmonary veins abnormally connect: supracardiac, in which the pulmonary veins drain into a vein above the heart, such as the superior vena cava; cardiac, where the veins drain directly into the right atrium or coronary sinus; infracardiac, in which the veins drain into a vein below the heart, often the hepatic portal vein or inferior vena cava; and mixed, which is a combination of 2 or more of the other types. Each type has a unique anatomical pathway for blood flow, which impacts the severity of symptoms and the surgical approach. The primary treatment for TAPVR is surgical repair. The goal of surgery is to redirect the pulmonary veins so they connect properly to the left atrium. The specific surgical technique will depend on the type of TAPVR and the baby's overall condition. In most cases, surgery is performed within the first few weeks or months of life. Before surgery, the infant may need medication to manage symptoms such as heart failure and pulmonary hypertension. After surgery, ongoing monitoring and care are essential to ensure proper heart function and prevent complications. Some children may require additional procedures or medications later in life. Unfortunately, there's no known way to prevent TAPVR, since it's a congenital heart defect that occurs during early fetal development. However, women who are planning to become pregnant can take steps to reduce their risk of having a baby with any birth defect, including ensuring they have adequate folic acid intake before and during pregnancy, avoiding alcohol and smoking, and managing any underlying medical conditions such as diabetes. The prognosis for children with TAPVR has improved significantly over the years, thanks to advancements in surgical techniques and medical care. With successful surgical repair, most children can live normal, healthy lives. However, some may experience long-term complications such as pulmonary hypertension, heart rhythm problems, or narrowing of the pulmonary veins. Regular follow-up with a cardiologist is crucial to monitor heart function and address any potential issues. Researchers are continuously working to refine surgical approaches and develop new therapies to improve outcomes for children with TPR, focusing on reducing the risk of long-term complications and enhancing their quality of life.